Welcome to Great Minds with Lost&Found, the podcast that connects people and reimagines systems to improve mental health for youth and young adults. I'm your host, Joel Kaskinen. Lost&Found is a comprehensive nonprofit organization that aims to do more to eliminate suicide for youth and young adults in the United States. Now that you know who we are and what we're all about, let's get to the show. All right. Hello and welcome back to Great Minds with Lost&Found, the podcast where we connect people and reimagine systems. Today's conversation is with Linda Duba, State Representative. Linda, how are you?
I am just great. Thanks, Joel. And it's exciting to be here. Thank you for asking.
Absolutely, of course. So let's start with just a basic introduction. Who are you? Tell us about yourself. Let's, let the listeners have it.
Who am I? Who am I? I'm a fourth generation Sioux Falls girl, which is, I was born here in 1956. Imagine that. So think of what I've seen in my lifetime. Yeah.
I don't want to think about that.
Well, when I do think about it, what the current state of the world today was a lot of what I saw in my youth in the 60s and the early 70s. So there are a lot of things that, I thought we got better at, but obviously no. So just a quick, who am I? I'm a Sioux Falls girl, born and raised, educated in the public school system, Washington High graduate, class of 1974. Next year, we're celebrating 50 years.
I can't even believe it.
Yes.
Wow.
It's true. And then South Dakota State graduate, 78. I was a school teacher.
Go Yotes.
Well, hey, I had 3 kids who went to the University of South Dakota, so I know how to say go Yotes.
Hey, we love it.
Go Jack, go Big Blue, go Yotes. I started my career as a teacher, and 4.5 years later, after 3 layoffs, I had to find another career.
Yeah.
So that was back in 1982, and Citibank was here, and they hired me. So I spent 26 years in financial services. Started there as a teacher in the training department. Can you imagine that? So people say, well, what jobs did you do? I'm not going to bore you with the details. Suffice it to say that I had a wonderful career with Citi. They treated me very well. They worked me hard, but, whatever. And in 2008, I had an opportunity to take a package and leave after 26 great years there, and I did. Thought maybe I'd do some nonprofit work like you're doing now, but as we know, in 2008, the economy went in the toilet.
Yep.
So I ended up trying to find a real job again. Not that nonprofit work is a real job.
Correct.
But this was, one that would, provide me with nonprofits at that time were just...
It wasn't anything that you were making salaries at.
Well, but it was a nightmare for them too because the world was crashing.
They didn't have funding. Yeah.
They didn't have funding. So I landed at a firm. I became a consultant for a technology firm. This call may be monitored for quality and training. I had so much experience from my days at Citi and they were a vendor of Citi, so they hired me, and I spent 8 great years there. I traveled all over the country.
Fun.
I met really interesting people. I did work in call centers, and I informed them when they hired me that I would give them till my 60th birthday, and then I would leave. And they, yeah, sure. And I did. I did. A month before my 60th birthday, I gave them notice, and I landed at MB. At Girls on the Run. 2 years there, wonderful job, but the opportunity to run for state office came up, and I answered the call, and the good people of District 15 have found it. This is my 3rd term, and my last, when I left MB, I was still not on Medicare. So for those of you who understand the importance of health insurance,
yes,
I went back and spent my last 3 years in the school district.
Wow.
Working for the Sioux Falls school system at Laura B. Anderson as a teaching assistant. And I am so glad I had that opportunity. I mean, I bookended my career. Started in education, ended in education. And here we sit today, and I'm a state legislator, serve on appropriations. I serve on the Government Operations and Audit Committee. We look at process and do investigations where they're warranted, and we've had a few since I've been there. Yes. I am currently running the work group for the long-term care, and I'm looking at regulations in nursing homes. I also serve on the Juvenile Justice Oversight Committee, which is pretty darn critical, I might add.
Yes.
And I have a tremendous interest in education, obviously, but in early learning, otherwise known as birth to 5. Some people would call it daycare or childcare. It's early learning. I have a tremendous amount of concern about where we're at with there today. And I just came back from a 2-day seminar at Stanford University. And I met with policymakers from all over the country, legislators. And I'm going to the White House on July 19th to talk to the White House about childcare and early learning.
That's so cool.
So, I mean, I've had tremendous opportunity in my lifetime, tremendous career. And like I say, the people of South Dakota, it is an honor and a privilege to serve.
We love it. Well, we are grateful not only to have you in state legislature. Wow, that was hard for me to say.
That's a mouthful.
That's a mouthful. Normally I'm so good at that, but not now. But we're grateful to have you here with us today. If you don't know State Representative Linda Duba, y'all who are listening, you need to meet her. She is a firecracker. She is an advocate through and through. I mean, you walk into a room and everyone knows that you are going to say some meaningful stuff. And I am so grateful to have you as a friend and as a representative and a guest today. So welcome aboard.
That's very kind. Thank you very much.
Yeah, absolutely. All right. Well, let's get into things, shall we?
Yes, let's do that.
All right. So looking at the current situation of mental health in South Dakota, as a state representative, you obviously wear several hats, and you advocate.
Got my New York Yankees hat on today, but
and you advocate for many different causes that not only are you concerned about, but your constituents are concerned about. And as the voice of the constituents, I'm curious, what was it that led you to local and state government, and what is it like right now?
Well, I alluded to it earlier when I said, I was born in the 50s, raised in the 60s and the early 70s. And what I saw then was inequality, racism. I saw war on TV every day. We had the body count. I saw the assassination of President Kennedy, his brother in 1968, Martin Luther King, and I saw our world turn upside down. We were living in sort of a bubble, but the war was escalating, and violence became a part of our everyday life.
Yeah.
And, we thought we got better, didn't we? Through the 80s, into the 90s. And we elected a wonderful president called Barack Obama. Some of you may not agree with that. I tend to think he was a very smart man. He grew into his presidency.
Yes.
But what we did see is we saw, even prior to that, we saw civility in politics. We saw an opportunity to reach out to those who don't look like us, who don't talk like us, and kind of make change in the world. There were a lot of monumental things that occurred in those 90s into the 2000s. And then along came the former guy. And what we now realize is there was unfortunately, a larger contingent than I knew about of people who felt left behind. And he ripped the Band-Aid off and exposed a lot of ugliness in the world. And so now what we have people who are marginalized, who are criticized for how they look, how they believe, where they worship, what they wear. And it's open mic night on criticism instead of civility and respect and helpfulness. We live in a world of divisiveness, and it is hard. And as a result of that, and then let's throw in the pandemic, shall we? And we know what that did to people. We had some mental health issues prior to the pandemic, and the loneliness. And, all of the things that happened where we had to, take care of ourselves and stay home and be safe. And children not being able to go to school, which to many children is their safe place.
Yes.
Not to mention the fact of the amount of learning loss that we had. That has really impacted us. And then let's just throw social media in there for fun. So here's where we're at. I ran for office because I felt that the former guy was destroying America, the America that I want to live in. Not the America that he visualizes, but the one that I want to live in, where a rising tide raises all boats, where we find ways to help each other, where we see a problem, and where that problem exists, we work together to find solutions.
Yeah.
We use tools, and not where we point fingers and blame. And so that's why I ran for office.
I love it. And what is it like today? Is there hope? Is there some light, or is it still kind of messy? I mean, as an outsider, I still see a lot of that division and that divisiveness and volatility in politics. And I would assume that's the case here in South Dakota. But
it is. It's messy. It's hard. It requires great patience, and it requires...
You have more patience than I do, I think.
Well, you don't hear me when I'm behind a closed door where I can just vent. And I do that because I think, but I don't want to do that in a place where we're trying to solve the problem, because that doesn't help. But, I spoke to Morgan Matson this morning. She was asking me about some of the legislation that we encounter in the legislature, especially around our trans children and families. And I just said, she said, do you want to bring additional legislation? I said, we shouldn't be legislating any of this.
Right.
What are we talking about here?
Yeah.
So I see it today. It's difficult. We hear of a legislator who thinks the Black Hills is a portal, and I'm like, wow. We live in a world now where they're just science and facts and data. What? I like to work in the world of the possible, and I like to lean on the experts, because I can't know everything. I certainly don't know everything. If you put me in a classroom or you put me in a process situation, I can manage pretty darn well.
Yeah.
But when it comes to, agriculture or medicine or mental health, I look to the experts. And, what I find most frustrating is we have people in the legislature who believe they know everything, and they come with a set of, I don't even want to call them facts. They come with opinions, and they're there to stir fear and misinformation. So I find it hard when that's what we see. But then I have hope that I can work with individuals who still believe in moving forward and using tools and helping people.
Well, we need more people like you who are willing to put things aside and look to create systems that work.
Yeah,
and
that's important.
and that's why we're here today. That's the conversation we're having.
Yep.
So speaking of, we often talk about the current state of national, local politics, government, etc. We talk about the volatile, divisive climate and how it impacts mental health of Americans, of South Dakotans, of politicians. How has your work as a state legislature, how has the polarization of the current state of politics affected your personal health and that of your colleagues?
Well, I think my children would tell you that they see that I have some stress. Yes, maybe. There are days when I leave the legislature in Pierre where I go back to my hotel room and I'm like, it's a tough day. So mentally, it is very hard and taxing to try to push the boulder up the hill. But if it's not going to be me,
who is it?
Who's going to be?
Exactly.
So I walk a lot. I used to be a runner, for those of you who know me, but had some medical stuff with my heart that doesn't allow me to do that. So I find that I can do a lot of thinking when I walk. I can come up with better ideas. But that's for me. For others that deal every day, I think about individuals who feel that they're under attack. There's some stressful days in the legislature where I see some of the members that I work with really struggling to cope. And it's not like we can, walk next door and find the latest behavioral health specialist. It's deemed a weakness, as it never should be.
Right.
Never should be. So it's not readily available to us. But I think what we try to do is rely on individuals who care about us, where we can talk about the concerns that we have, and just vet, just vent, get them out, and then take a lot of deep breaths and go back in.
Yeah.
I mean, that's how we deal with it now. But that's nothing compared to think about the trans children and their families who year over year wonder what crazy piece of legislation is coming now to make them even more marginalized than they already are. And what attack are they going to see from the administration? So those are the people I worry about.
Yeah.
I'm going to be okay, relatively. But they have to live it every single day.
Yeah, totally. Ugh. It's tough. I thank you. I think a lot of people think that I'm going to run for office someday because I'm very vocal and I'm very politically engaged. But for my mental health, it is best that I don't.
But you contribute in other ways.
I do. I mean, that's why I volunteer with so many different organizations and why I'm so outspoken about the things that have impacted me and that have impacted my communities.
Sure.
Yeah.
Well, I was on a phone call today with some families. They're in the Families 360 program, and it's for families who have disabled children and adults in their family. You want to talk stress and mental health? Yeah. So they're the families that I'm more concerned about, because we've had to really dig down, roll up our sleeves, and improve that process.
Yes.
And it's got a long, long way to go. And today on a conference call, just the simplest thing of communicating, getting a communication out, didn't happen. Well, these are families that need this information. So that it's a trigger. And so what we're trying to do is get them the help and the supports that they need. These are caregivers of children and adults with disabilities. Imagine the stress level that they deal with. Yeah. So I'm going to be okay. My job is to find the helps and supports that they need.
Agreed. And that's part of why I do it. I'm a white male living in a white male-run America. Yeah. And I have so much privilege, and I have immense platform and power through the jobs that I do have, through the advocacy work that I do have, through, the platforms that I have on social media. I'm doing this for the people that don't have the voice that I do.
They don't have the voice.
Yeah, exactly. Well, let's move on from the impacts of mental health in legislation to a little bit more work. Oh, someone is getting
somebody wants to call.
All sorts of calls here.
We got a call-in audience.
Jeff.
Stop. There you go.
Darn, Jeff interrupting our podcast. No, that's okay.
Just step back to that first sentence.
Yeah. That's okay.
We can do that.
Anyway, from your viewpoint as a legislator, how would you describe the big picture of mental health in South Dakota?
I would say that we're at the CD level. If I were to grade on a scale of A to F, we're mediocre at best and trending downward. There are a number of factors involved in that. One is just the number of people that are not entering the field of mental health in terms of, sociologists, psychologists, psychiatry, social workers. It's a tough environment. COVID was just devastating to that profession. I know that they were able to do a lot of remote counseling, but still, it's been hard on them. So that's part of it. We're trying to address that in the legislature In fact, we brought a bill last year that failed in committee. It's got to come back, where we look at that profession of those advanced degrees in behavioral health, and that we find ways to help fund or totally scholarship those individuals. It is an expensive proposition to become a mental health counselor.
Yeah.
Very expensive, 6 years, a lot of clinical hours. That is not a cheap education, but we need more of them. They're valuable to us, so we need to fund a certain number of scholarships to entice young people to come into that field. So that's part of our problem. And the other part is that we just, with the current workforce, they are overloaded. They're overloaded.
Absolutely.
And they feel the stress and the pain. They know the importance of their jobs. But they also see that there's just been a huge rise in people who are struggling. Not only in children, but in adults.
It doesn't discriminate. It's across the board.
It does
Everyone's
not.
struggling.
It does not. And so the services that we need, this is the first year that I've served in the legislature where we're fully funding mental health supports for those who need them. Now, you can always go to a private pay, but many people rely on Medicaid and sliding fee scale. And we have not in the past kept up our state end of the bargain to support those.
Wow, yeah.
So this year, we stepped up.
Love that.
Yeah.
Yeah, that's huge. I mean, that's a big win.
It's a step in the right direction, but we need to get better.
We can always make improvements. Well, you already asked or answered the follow-up question that I had, which was, what are the challenges that we are facing here in South Dakota, and how can we improve? So thinking about making improvements, the work that we do with Lost&Found is guided by the CDC's 7 strategies for suicide prevention. And I want to ask you, in your work in legislation and, trying to advocate for those who need additional support and, their lives are on the line. Do you utilize any of these 7 strategies that are outlined here on this paper that I've given you?
Are they here?
Yes.
Yes.
How do you utilize them, if any at all? And then what improvements would you see, just, briefly as you're, kind of perusing, that you would make today?
When I look at this, for example, I'm going to pick out one that says teach coping and problem solving skills. Some people may not be aware of this, but we are doing that down in the grade schools. We are doing that in the K through 12. It's called social and emotional learning. And we teach children how to communicate effectively with each other, how to listen effectively, how to work in groups, how to regulate. Now, when I talk about regulation, if a kid is experiencing some sort of a trauma from, something that happened at home or a trigger that affected them in the school day, whatever is going on, teaching a child how to take a step back, to regulate, to get out of that amygdala and get back up in that upper brain. And now I'm talking brain science here, but it's so important. And so that is a focus that we really work on in the grade school, that hopefully, and I know it carries through because teachers are constantly doing that. Our counselors, our administrators, our teachers, me as an aide, I worked with a lot of kids who had that would struggle.
Yeah.
And that was my job, was to work with those kids who are struggling in school. And much of it is just some of the traumas that they're suffering. And people are going to say, what, are they getting beat up every day? Well, no, not necessarily. No, absolutely not. But they're living in maybe substandard conditions where they don't feel safe. Yep. They may not have enough to eat. They may be having to be the big brother or sister while mom or dad or both are working overnight. And, you try coming to school and learning. So that was something that I think is very important. When I read all of these things, these are the, create protective environments. Oh my gosh. All right. We obviously, when we've got people who are have suicide ideation or they're even, prevention, we've got to look at what is their environment like? Who are they surrounding themselves with? Not only is the physical space safe, but is the mental space safe for them? Are they exposed to, situations and people that are constantly making them fearful, making them anxious? These are the things that we as individuals need to help recognize. And so we can do strengthening economic supports. Well, again, where does government come in, and how do we play in that space?
Yes. Honestly, that's probably one of the biggest ones that you all are.
That's where government can play in that space. But then we need to recognize who these individuals are and get them the help and supports that they need.
Absolutely.
Help guide them. It's not like somebody wakes up one day and says, I'm going to call the government for help, because they don't know where to turn. When you are desperate and you're in a situation, everything spirals downward.
Yep.
So again, whether we're in the workplace and we see this in an individual, or we're in the school system and we see this in an individual, or even in early learning in childcare, recognize what you're seeing from someone. Are they experiencing some sort of a trauma where they withdraw into themselves or they act out in any way?
Yep.
And our first response to them ought to be, what happened today? Not what's wrong with you, but what happened today? I had to relearn that when I went back into education. So I see the importance of this. I know that you have peer-to-peer counseling at the colleges. I am so thankful for that, and I know that we're trying to push it down into this K through 12 system, and I'm thrilled that we're going to be doing that. But that again also takes funding, because there's training that needs to occur for those peer-to-peer mentors.
Yes.
So funding is something that I can help with, and we did some this year, but then you've got to apply for a grant.
Yep.
And we need to do more of that. We need to continually recognize that we need to fully fund mental health programs. I could
go on and on, I'm sure. Yeah.
I really understand that these 7 evidence-based tenets are critical. And I know that there's a role that government can play, but we as individuals also need to play that.
Yes.
And I also want to say, I want to shout out to teachers, counselors, administrators that wear 2 hats. They educate and they serve as peers and role models for our children. They do a great job.
Yeah, definitely. I'm with you. Shouts out to all of those people working in, the service industry and, the social and emotional support industry. Shouts out to all of them.
Yeah.
Hats off.
Hats off.
Definitely. All right. Well, as we consider solutions for these challenges that we're facing,
Yes.
And considering the 7 strategies that we just went over, what are some ways that South Dakotans can create better systems for good mental health for the people that are living in these communities alongside of us?
Well, let's talk about systems. What is a system? System it can be a group of people in a process with physical space, not physical space, people performing certain functions, or what we need to do is recognize as a community where our gaps are.
Yes.
Okay, so where are the gaps? Let's identify those gaps. All right? What are some of the possible tools that we can use to help plug those gaps? What resources do we need? Do we need more counselors? Is their pay, and compensation correct?
Yeah.
And it does come down to that. You cannot expect a professional who is trained clinically to survive on $15 an hour.
No.
I mean, that's just not, no. So we need to understand pay and compensation. We need to understand where we have mental health deserts, as I would refer to them. And I would think that South Dakota has several of those.
Oh, absolutely.
We are a very rural state. Imagine that you're a farmer in northwestern South Dakota, and you've been dealing with drought now for 3 years.
Yep.
Okay. So now I'm talking the language of an individual who's seeing the family farm possibly go into bankruptcy. There is so much desperation, isolation, How do we identify who that individual is and get them the help that they need because they may not cry out?
Right.
So individuals around that individual must need to recognize that. It comes back to us first to recognize individuals who are in pain. And then we need to find ways to get them help. And so I think about telehealth. Telehealth is another tool. And we used it during the pandemic, and it has been effective. And it may be telehealth, it may be the 211 helpline, it may be 988, it may be some technology out there, but there's got to be an opportunity for us to say, we're here to help you, we're here to listen, we're here to
absolutely
find you the next thing. But it has to be that we identify what our gaps are and then work towards a solution to fill those gaps.
Definitely. I 100% agree with you. And I love that you made reference to the mental health deserts and the individuals who are impacted by it, not only impacted by it, but the family members and friends and loved ones of those people. I think that's where it starts, is the people that are going to advocate and rally around the people that are struggling.
Because if they don't recognize it and that individual is successful in their motion, taking their own life, they will wonder, what could I have done differently, or why didn't I see that? And that is just as impactful and devastating to the people left behind. They're victims too.
It sure is. Definitely. Well, what do you believe is the biggest barrier of access here in South Dakota?
Again, I'm going to just say it's just resources. And we've heard that. We heard that when the mental health professionals came to speak to us, that we're losing people in the profession, and that we need to encourage. And Senate Bill, was it 1078, was the one where we were trying to create scholarships for people in college. Didn't make it out of committee. We actually had to withdraw the bill. I need to talk to the original sponsor of that bill and say, let's go back. I'm roll up my sleeves. I'm going back.
Yeah.
We'll work on it now. Let's work on it now. I know where some of the roadblocks were, and we've got to overcome those roadblocks.
Definitely.
There's always a roadblock, and it's usually in government.
How do we as constituents, myself included, advocate for gun safety in a way that is going to help us decrease the numbers of firearm suicides?
Finding out who your legislators are and asking to have a reasonable conversation, a one-on-one sit-down, a discussion. Because I will tell you, writing to them and giving them a generic letter does nothing. I'm going to be honest with you. It does not. Especially if you've got someone who's, very much... Because I think they need to understand and see all sides of the issue. This is not a gun grab. This is not, we're coming to take your weapons away. So what we need to do is explain why it's important and how it can save lives. And continually give the anecdotal stories that support the narrative, but also tout the facts and data over time.
Yep.
And hope that the environment changes. Because short of a brain transplant, I don't know. I understand that this year when I brought those two bills, that was the most that gun violence and gun reform had been talked about in the state legislature for years.
And at least it's being talked about. But like I said, at least.
Baby steps.
Yep.
At least.
Yes.
Baby steps.
All right, well, let's wrap things up. If money and resources were unlimited and you could wave a magic wand and change anything right now in this moment about the mental health care systems in South Dakota, what improvements would you make? What would you do?
It's a tough one.
I know.
I would
Asking the hard hitters here.
I'll tell you one thing. I would have a mental health counselor in every school. In every school. So that's money and resources right there. So we have school counselors, but they're not necessarily, they're not those masters mental health behavioral specialists.
Yep, correct.
So that would be the first thing that I would do. because down in those early grades and working up through, mental illness does, it may present itself early, it may be later in life, but when we recognize students who are struggling and we can give them the skills to cope, having that mental health counselor there could help.
Mm-hmm.
So that is one thing I wish, I would hope.
I love that.
And I mean, there are other things, just remove the stigma of going to see someone. People whisper. We shouldn't whisper. Every one of us at any point in time in our lives has been in a dark place. So, I don't know how we do that other than keep giving these positive messages and have people come out and talk about the importance of behavioral health. We have a large contingent of people in our penitentiaries that are chemically addicted. And 70% of those people are suffering some mental health disease.
Mm-hmm.
They're self-medicating.
Mm-hmm.
That's why there is an addiction.
Yep.
So
it's co-occurring
illnesses. They are and so they're trying to dull the pain either through alcohol or through drugs. And so another thing that I wish is that we had more facilities that could treat addiction. And it's not a one and done. It's not a 90-day program.
No.
It is a lifetime behavioral change.
Definitely.
It's a very hard thing. It's a disease.
Mm-hmm.
Addiction is a disease. Mental health certainly is a disease. And when you put the two together, that's a deadly cocktail.
It's a deadly cocktail. It sure is. All right, Linda, we've got 2 more questions here for you. What is one thing that you've learned in this lifetime of yours and the plenty of things that you have experienced that you want everyone to understand? This can be mental health related. It can be career related. It can be just something that you have picked up in the grocery store.
I got tears in my eyes. The thing that I learn is that the thing that I've learned as I get older is that I need to be more open to listening to all sides of an issue and constantly learning, because if I just focus on the narrow lens that is me, I will miss some very important things and ideas and thoughts and helping people. So being open and learning, that doesn't mean that I have to agree all the time, but that I have given time and energy to individuals. And I get some pretty interesting emails in my legislative email. But what I've tried to do is think, okay, what's driving this thought process?
Yeah.
Right? And that is the thing that I have learned. If I knew that at 18, I'd have been a much more effective early adult.
It's part of growing up, I think.
It is. It is part of growing up, but some of us choose not to get outside of our comfort zone.
Definitely.
So that's my learning.
I love that one. I'm going to carry that one with me. And lastly, is there anything that we did not talk about today that you would like to add that you thought maybe we'd discuss?
Not really. I would just encourage people who listen to this podcast and just everyday citizens to step outside of your comfort zone and learn something new every day about someone you know, someone you don't know. And listen, I need to work on that myself every single
Me
day.
too.
And I will become a better human. I want to be my best self when I'm taking my last breath. I try to be my best self every day, but I want to reach that pinnacle when I take my last breath. That means I'm constantly improving.
Yeah, definitely. Awesome. Well, thank you so much for having this conversation with me today. I really appreciate it. I appreciate you. I appreciate getting to work alongside of you in so many different efforts, whether it's mental health or gun violence prevention or literally so many other things that we work together on.
So many other things.
I'm very grateful that we got to sit down and have this conversation
So
today.
am
So
I.
thank you.
Thank
Yeah.
you.
Awesome. Listeners, thank you so much for tuning in. I appreciate it. You know where to find us, resilienttoday.org. Follow us on all social media channels at Resilient Today. And remember to rate, subscribe, and review to Great Minds wherever you listen to your podcasts. Until next time, stay well, my friends. Thanks so much for listening. Remember to subscribe, rate, and review Great Minds wherever you listen to your podcasts. For more information about Lost and Found, go to resilienttoday.org. That's ResilientToday.org. Follow us on Facebook, Instagram, Twitter, LinkedIn, and YouTube at Resilient Today. Until next time, do more and stay well.